Okay.
Let's open it up.
So this is a very common misconception.
Well, that's certainly a myth.
I don't think this is true.
There's so many different things to highlight as myths in this one.
If you use medications, you are not sober. This is a myth because there are multiple roads to recovery. For example, I work with commercial fishermen who have high rates of pain and injury on the job. They may need pain medication just to get through the day. There's no good medication or bad medication. There's just medication that's used properly or improperly.
You can attend an AA when on medications like methadone. Yes, you can. Some people are getting the message that you can't and are given the message that you can't, but you can. People should be welcomed into AA, NA, any 12-step program on medications.
People have to hit rock bottom before they can get better. That's true for some, but that's a myth that there is one rock bottom as a definition. For some people, it is when they lose all sense of hope and feel completely hopeless that they can then work to get better. And for other people, it's just that one time that they went down a path and they're saying, I have a problem and I don't want to continue down that path and I need to get better, and that's great. But everyone's desire to get better is different.
You can't have access to medication-assisted treatment in jails or prisons. This is a myth, particularly starting in 2018 in response to the CARE Act, which required facilities to allow all FDA-approved treatments for OUD to be administered in correctional facilities.
Addiction is a criminal legal issue.
It is imperative that law enforcement is involved when people get out of line. I have so much to say about this one.
Addiction is a medical issue. It's a disease.
Addiction is a chronic, relapsing medical condition that is actually not best served by the criminal justice system.
There's no other disease where the best treatment is to arrest people and incarcerate them and punish them for being sick. We can't arrest our way out of this problem.
So here's my first question. Abstinence is the only way to achieve recovery. Really? I don't think that's even close to correct. Who am I to determine exactly what recovery means to someone? Certainly, abstinence can be a very legitimate and valid pathway of recovery, but it's not for everyone. I think everybody needs to determine what's their best way, what works best for them, what is it in their life that is meaningful, and how do they achieve that? How do they achieve a sense of wellness? To determine that for somebody it has to be through abstinence, I think it's really myopic. It's really judgmental. I don't think it's something that works for everybody across the board.
There are very few physicians who specialize in addiction medicine.
Because it's not satisfying to treat people with addiction.
As someone who has worked with many patients with addiction and has helped to treat addiction, I can tell you that that's not true.
As an addiction medicine physician who's also a general internist, I can say without a doubt addiction medicine and caring for people with addiction is the single most satisfying and rewarding thing I do in my career.
For many patients, you are able to make a radical change in their lives where they have gone from a place of hopelessness to all of a sudden feeling and functioning like a person again. And that is really powerful.
The reason we don't have more doctors trained in addiction medicine has a lot more to do with stigma, discrimination, and bias within our healthcare system and within our society at large than any other cause.
Okay. Recovery homes do not allow people on medication to stay in their programs. So how fitting is that one for me, because I run 5 recovery homes, 2 transitional programs and 3 adult residential programs. And that is a myth. That's not true. As far as recovery homes go, or sober homes, any licensed program by law has to allow people to be in recovery homes on medication. So whether it's Suboxone, methadone, Vivitrol, behavioral health medications, we're required by law to have them there. What we look for is people are taking them properly and they're working properly, then you don't even know they're on them. People that you can tell that they're on some sort of medication, then you want to make sure that they get seen by the doctor or the psychiatrist again so that it's properly adjusted. The goal is to help them live their life, have a full life, and in order to do that, some people need medication. So we want to make sure that they're on it. We want to make sure that it's proper. It's not up to a program to determine what is proper for somebody, residents, for what somebody to be on or not be on.
People who use drugs never care about their health. I am super fortunate to run a syringe exchange program, and I would definitely say that some of the folks that we have come to the exchange are some of the most thoughtful and careful people that I know, and it's important that we know that.
Oh my goodness. This says addiction is not a real disability. Well, you know, it is a disability, and it is a real disability. When people use substances such as heroin and they can't stop using, that's a disability. If it gets in the way of your ability to go to work, go to school, to concentrate on your family, that's a disability. And there are routes for recovery, and there are multiple pathways for recovery, and we support all to use them. When you are in the throes of addiction, it is a disability, and there's hope.